does a man know if he has a weak pelvic floor? What I'm about to talk to you about has to do with the activities that you may be doing that are contributing, some of the signs and symptoms of weak pelvic floor in men, and what can be done about it, what are the options available, and what is effective and what is not. So you have to understand this is purely coming from my perspective, treating many patients with pelvic floor dysfunction. So when it comes to men, for one, yes, you do have pelvic floor just like any other human being. That's the floor of the pelvis. It's musculoskeletal, meaning it's just like all the other muscles you have, and it's a voluntary muscle. It is directly impacted with you breathing in and breathing out. When you breathe in, the muscles relax. When you breathe out, they contract, and so you breathe out. When these muscles are weak, not everyone ends up with, let's just say, incontinence. Not everyone shows up with not being able to hold your pee, or they sneeze and the pee comes out, or things like that. A lot of times when it comes to weakness of the pelvis, this muscles inside the pelvis, you got to understand you can have muscles inside your pelvis that are weak and everything else being of the right tonicity. Where it's weak, you may have symptoms, but in the same pelvis, you can have tightness. You just don't know. So it can show up as those signs. It can show up, from my perspective, from biomechanical perspective, in the way you walk, in the type of muscles you use to perform simple movements like walking, like squatting, things like that. I'm not assessing you for workouts. I'm assessing my patients for functional patterns of movement. I ask them to perform a very simple exercise of getting up, and I'm looking to see, are they moving, or are they using their butt and their legs or not? And you'll be amazed at the number of people who can't do it. In fact, 99.999% of my patients can't do that. So these are the things that you don't know. You may be going to the gym and working out. You may look fit on the outside, but the reality is you are not kind to the muscles inside of your pelvis. So a lot of times this weakness also happens as a result of sedentary lifestyle. So let me explain something. When it comes to sedentary lifestyle, that doesn't mean you sit on your butt all day and you don't go work out. That just means you have an off-balance lifestyle, which means you work and then you take your exhausted body to a gym or playing basketball, whatever the exercise may be. An exhausted body is not going to perform well. So something has to perform for you. So that something pulls the whole body out of sync, dancing with the rest of itself. A muscle becomes weak when you're not using it. The patterns of movement that you're using, the methodology, the blueprint of movement does not include those muscles. So they're weak either as a result of not being called into play, or they're weak because they're exhausted from overperforming. They're exhausted. So you may end up with things that are, or signs and symptoms that signal UTI, signal STD, especially if you're young. That's an automatic assumption. They may give you muscle relaxants. I'm giving you signs and symptoms of things that are tight. But when it's weak, that weakness can be from being overly tight. So the shifting of the task from an exhausted muscle group to another muscle group means that first muscle group is exhausted and it's weak and it's tired, and now another group of muscles are performing its task. So your symptomology, your symptoms are showing up as tightness. but you can't have tightness in one region without weakness in the same region. In nature, we take care of the tension, the tonicity of the muscles here, and the strength of them with biological breathing. Your breathing patterns are compromised because of many things. That's a whole different video. So when it comes to the treatment, you've got two options, basically. This is ruling out pathology. Either the therapist, the pelvic floor physical therapist, goes through the anus to the muscles to reach the muscles that are tight, or that are weak. So the finger is in and then working on those muscles. Well, how far do you think that finger is going to go? Number one. Number two, shouldn't we be asking why these muscles are tight or weak? It doesn't address that. That's why, in my opinion, the proper approach needs to include the foundational piece, which is stability of the pelvis, the functionality in movement. If your pelvis is unstable, if your movements are not functional, you have the reasons for your pelvis to become unstable. So as long as that exists, the reason why these muscles are weak, the reason why these muscles are tight is going to exist. You're not solving the problem. Maybe you get some improvement, but not much. Or maybe you get really good improvement, but it doesn't last that long. So what's the question, or what's the treatment? What's the approach? You got to understand some basic foundation. I think one of the biggest challenges that we have, we meaning clinical rehabs, that's my world I'm telling you about, is that patients don't take the time to understand what is happening. They don't want to know, they just want to fix. The problem's not going to go away if you unknowingly contribute to the creation of it. And then from a clinical aspect, from the clinician's part, it takes all day to talk. It can get exhausting. So what's the solution? You got to find a provider that loves what they're doing, are going after the why behind the instability, are most importantly, at least in my opinion, perhaps because that's what I do in my practice, I want to make sure my patients understand what I see in them. They understand what I see, they prevent what I prevent, they problem solve the way I problem solve, because that way they will stop themselves from getting the issue. They know how to tackle it, and they can pretty much take control of their movement related issues. Pelvic floor dysfunction in men as a weakness or tightness is from lack of understanding of how to be. That's the reality of it. So that just means you got to invest in learning how to be. So going forward, not only that problem, but a lot of other problems that are musculoskeletal. We're talking about SI joint problem, lower back problems, hip issues, postural issues. These are all related to your movement patterns and functional patterns of movement that are not existing. So I hope that this made sense. You gotta invest in yourself, in understanding how to be, so that way you don't have to rely on so many different providers for mediocre at best approaches to get rid of the issues you have. Not having those issues is a much better way to live life. Not doing things that contribute are the much better ways to live life. Hope this helped, and thanks for watching.